Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome everybody again to another episode of our show. Today bringing you another fascinating individual who is helping to create a better tomorrow for so many people around the globe. We have the honor of being joined today by Donato Tramuto, who is a healthcare executive, global health activist, author, and who is widely recognized for his commitment to both social change and transformational leadership in healthcare innovation. Mr. Tramuto is the founder and chair of the Tramuto Foundation, which advances young people's rights to education, healthcare access, and combats human rights violations. His 3-decade commitment to social change and innovation has earned him numerous awards, including both the extremely prestigious Robert F. Kennedy Ripple of Hope Award and the RFK Embracing His Legacy Awards. He currently serves as a member of Robert F. Kennedy Human Rights, chairman of this Leadership Council, and he's also a passionate champion of various cutting-edge approaches to not just healthcare access and drug safety, but addressing an important topic we talked a lot about on the show, the social determinants of health. Mr. Tramuto has a long history of bringing together social commitment with this healthcare innovation, served his roles as CEO of Tivity Health, as founder of Physicians Interactive Holdings, and ultimately launched in 2011 Health eVillages, which is a nonprofit organization providing state-of-the-art mobile health technologies in challenging clinical environments around the globe. Mr. Tramuto is a member of Brown University Healthcare Leadership Board, as well as a member of the Advisory Board of Boston University School of Public Health, and holds honorary doctorates from University of Massachusetts Lowell, Thomas Jefferson University here in Philly, LaSalle College, and St. Joseph's College, and is accomplished author of 2 books, including Life's Bulldozer Moments, How Adversity Leads to Success in Life and Business, and his current book, which is going to be released April of this year, The Double Bottom Line, How Compassionate Leaders Captivate Hearts and Deliver Results. A lot to talk about. We're honored to have him. Donato Tramuto, thank you so much for taking the time to come on the show.
Oh, thank you very much. I appreciate that introduction. It's beginning to sound more and more like an obituary, but we're happy to be here today.
Far from it, but I really appreciate your time today. And, I was saying offline, I'm going to start the show off today actually by stealing from you, stealing a question, which, I've listened to past presentations of yours. Basically, tell me about your why, or in your case, whys. Why social determinants of health, why public health, and ultimately why the Tramuto Foundation?
Well, great question, and I appreciate that question because it's always the first question that I will ask of anyone who I meet for the first time. I think that you can't describe your why just in one answer. I think for me there's two whys: my personal and my professional. I think my professional why was stemmed from the loss of my hearing at age 8. I was 8 years old when I lost my hearing, and for nearly a decade, I had little to no hearing. And so during those 10 years, I experienced the most profound sense of loneliness. As we know today, the loss of hearing is one of the key contributors to feeling isolated and to feeling lonely. And I still feel that because hearing aids don't do 100% what your natural senses are able to do. But during those 10 years when I lost my hearing, I made a commitment to myself that if I ever had my hearing restored to the point that I could perform in professional duties, that I would devote myself to healthcare. And I had a second tragedy that happened during that time. My speech pathologist was my sister-in-law. And 3 months after the last surgery that I had in 1972, she died in childbirth. She was given a medication that she was allergic to, and she died delivering her second child. And so I devoted my life not only to the social determinants of health, but also to creating a safer environment for how information gets disseminated. My personal why, and to your question about the foundation and why I've devoted the last 2 decades to philanthropy, was unfortunately related to another unfortunate event, September 11th, 2001. I was scheduled to be on the second plane that hit the South Tower. However, the night before, I had a toothache, and I decided that I would leave the night before because I needed to see my dentist, and I was speaking at a healthcare conference, and I was not going to speak with a toothache. I changed my plans, but my 2 friends and their 3-year-old son, who had been staying at my summer home in Maine, unfortunately got on the plane, and they lost their lives when the second plane hit the South Tower on September 11th, 2001. And I write about this in my first book, but I decided rather than have hatred and anger in my heart, that I would channel the loss and the grief in doing something good. And so my partner and I launched, which is now, we just changed the name a few months ago to the TramutoPorter Foundation. My partner has been a very significant part of the foundation. But what we've done over the last 2 decades is to identify young children who, like myself, have had some challenge in their life. It doesn't have to be a medical challenge. I had a medical challenge, but there are a lot of young kids that have challenges with respect to financial, they have challenges with respect to being bullied. And we've now have helped nearly 75 young students go to college. And it's not just the tuition assistance. We mentor these young adults. And, you know, as I always say, we don't create who they are, they create who they are. We just provide the necessary tools to get there. And in addition to the 75 students, we've helped more than 50 organizations. And so my professional why I describe, but my personal why has been to make the world a tad better than when I arrived.
Excellent. Excellent. I appreciate you sharing those stories too, Donato, because they're so very important in sort of the big picture of what you've created and what you're creating. You know, in the book that's scheduled to come out shortly, The Double Bottom Line. This book, you're going to be exploring the importance of compassion as a force in business in terms of advancing the well-being of not just the company, but of course its people. And it's interesting. Last year, I got to spend a little time with Dr. Dupton Jinpa, the Dalai Lama's translator. He heads this Compassion Institute. And I read him this general definition. I pulled it out of the dictionary. Defining compassion as a sympathetic pity and concern for the sufferings or misfortunes of others, involving allowing ourselves to both be moved by their suffering and experience motivation to ultimately help prevent and alleviate it. He had said that wasn't enough. He brought in this factor of joy that as a result of helping to alleviate and prevent suffering, we on both ends experience joy in our lives with the sufferer and one helps alleviate it. Talk a little bit about what your definition and thoughts of compassion are.
Well, it's a very, very great question. I'm so happy you asked it because the real essence of the book was our having done 2 research. The first was a cohort of 40 world leaders to whom we interviewed this very question. What does compassionate leadership mean to you? Yep. But then we did something else. We went out and we surveyed 1,500 workers throughout the United States to find out what the compassionate leadership style meant to them. What we found in both of those studies is that compassion is not just about being kind. It's not just about, showing empathy. What compassionate leadership is empathy in action.
Mhm.
So let me give an example. I could walk down the street and say, gosh, I feel sorry for that person who needs food, and then I just move on. Well, I have now displayed empathy. But true compassionate leadership is taking that empathy and converting it into doing something good, doing something about it. And that was the common denominator of the 40 plus leaders to whom we interviewed, is across the board. They gave examples of issues and challenges that they had seen in the workplace or they had seen in their community, and they did something about it. And so for me, that was a real wake-up call that, a lot of people will say to me, yeah, I'm kind, I'm nice. It's just not enough if you're going to move the needle toward a more compassionate and kinder world.
Excellent. And I've not had a chance to look at the book. As I mentioned, it's coming out, but I did get to, I did a little research and a bunch of the names that are going to be represented in the book that you did your research with. And I thought we could just touch on a couple of them because some of these themes overlap stuff that we've touched on the show. And one of the more fascinating ones that stood out was this young gentleman named Jordan Mittler, only 17 years old, founds his own company that is specifically focused on educating seniors. And this is such a, we touched on this topic of intergenerationality, the importance of the young learning from the elders benefiting from being around the young. Talk a little bit about what you learned from Jordan Mittler, if you would.
Well, several things I learned from Jordan. Number one is he really did define the definition of compassionate leadership. His grandmother, or maybe his grandfather, but one of his grandparents had a difficult time with getting onto social media. And so he went over and he spent the time to help them learn how to turn the device on and, how to access social media. And then he realized if this is happening to my grandparents, this must be happening to lots of other seniors. And to his credit, he launched the organization that now educates seniors. Very interesting. So it is a small world when you think about it. In 2018, I did an op-ed, and in that op-ed, I wrote about the importance during the holidays to raise the question of loneliness at the kitchen table. And Jordan ended up writing to me, and his mother said to him, "There's no way that a CEO of a public company is going to write to you and onto your email." Well, they didn't know me, and so when I received his letter, I immediately wrote back during the holidays, invited him. I was going to be involved in NASDAQ for the opening bell in January of 2019. And I invited him, and together we started to talk about what we could do in terms of collaborating. There's a new word that I introduced in the book, and it's called collaboration.
Yeah.
And what I mean by that is the more you're willing, regardless of somebody's age, and to your point, Jordan is 17 years old. So what? He developed an innovative idea. I am 65. Merging those ideas created a real movement around how he could scale his business. And so compassionate leadership is also the willingness to accept across all spectrums of the age band, ideas and thoughts, and to really be able to collaborate with that individual. And so Jordan, hands down, speaks to so many of the key nuggets that we identified in our survey about collaborating, about recognizing that even a 15-year-old individual could have as much thrust and power in terms of innovation and collaboration. It shouldn't make a difference how old someone is. What we should really look at is the difference of committing ourselves to working with one another in a way that can address some of these problems that we're facing in the world.
Excellent, excellent. So now to say a couple words, if you would, another one that's, well, actually two in this case, is the husband-wife team of both Bruce and Janine Broussard. On one hand, you have the chief executive officer of Humana, one of the largest health insurance groups in the country, very focused also on the social determinants of health. And now his wife, Janine, she is focused on a different aspect of the social determinants with her HUG reading program. Two very different approaches, but sort of getting to the same place. Talk a little bit about this husband-wife combo, if you would.
Well, you really have to know the two of them because, I've known Bruce for many, many years because of our association in health. And then on the other side, you have this very thoughtful individual in Janine who shares the common denominator that Bruce brings to the table, and that is people first. I think what she's doing with young children, Janine, through her experience in the community, has really recognized that if somebody can learn to read, especially in the pockets where you have an individual who doesn't have the financial capacity or may not have access to the same educational tools that you and I have. Yet if you could teach them to read, it's been proven that you can keep them out of the prisons. You can give them opportunities that they normally would not have. And so my point is that Bruce, this very compassionate executive who's done extraordinarily well at Humana, he's been able to deliver and provide shareholder value, but it doesn't stop there just with Bruce, is that it's extended across his whole family. And so that's why I'm glad you really pointed out the husband and wife, because there was a little subtle message that I wanted to convey, is that compassion, normally you'll find it does not just exist with one member of the relationship that's been formed. That what you'll find, it's just like my partner and I, is that we both have been involved in the charitable work. It's not just been Donato. He's immersed into the very initiatives that I strongly believe in. He identifies issues in the community and he'll bring it to the foundation board. And so there was a subtle message to those who read the book that most compassionate leaders are not isolated. They're not doing this in a vacuum. They have support systems in their families who, quite frankly, will embrace the same ideas and the same values that individual. Now, Bruce has obviously a bigger platform because he's running a major, Fortune 100 company. Sure. But it doesn't really matter what degree of platform you have. And by the way, there's this is my own quote, and I came up with it many, many years ago because I had so many people say, well, you know what? You have the means to do what you're doing. And I once just looked at myself in the mirror and said, that's not true. When I had no resources, I still was giving back. And so I came up with the following quote: it makes no difference how much you give. What makes the difference is you gave. It makes no difference how much you do. What makes the difference is you did something.
Mm-hmm. Very elegant quote and extremely meaningful. But I appreciate sharing that. I look forward. I very much look forward to the book coming out, so we can learn more about these fascinating people that you've spoken to. Talk a little bit about, we've talked about social determinants of health, and we normally think of sort of the things like nutrition and fitness and so forth, but we tend to overlook, not in recent years, of course, the importance of social connection. You mentioned loneliness as a child in your own story. Talk a little bit about what you've seen from your experience in the past with Tivity, but some of what you're doing now, and just terms of isolation. We hear these figures that social isolation during COVID is like smoking multiple packs of cigarettes. And then also you talk about, simple things we could be doing: a touch, a hug. You use the quote, warm human tradition of souls coming together. Talk a little bit about this, if you would.
Absolutely. And, you mentioned the Dalai Lama, and he once said, and I think it's a great understanding of how you reach these areas where you embrace the notion of doing something. But he once said, in order to understand the pain of somebody else, you yourself have to experience that pain. Yeah. And so when I was the CEO of Tivity Health, before that it was Healthways, and I was running the Silver Sneakers program, which, as you know, is a program that provides physical fitness to millions and millions of seniors. Yep. One of the first things that I did is I went out and I visited with the seniors. I went to the actual classes. And what I learned is that the seniors who were participating in the Silver Sneakers program were not participating because they wanted to bench press 150 pounds. They were there because they met new friends. They became connected to other people that they normally would not have had a connection with. And so the light bulb went off that, wait a second, there is a significant sense of isolation. And it's obvious when you turn 65 and you retire, you think you're going to have this enormous network of people. Well, you just lost your first network, and that's your fellow associates. And then you move into a community and your friends start to pass away and you lose that. And then the children have to take the car keys away from you. And before you know it, you've lost the ability to go out and meet people. And so this sense of loneliness and isolation was picked up by me back in 2014. And it wasn't really at that time one, there wasn't one aspect of recognizing how severe. It was only in 2016 and 17 when it started to escalate that this is a very significant issue. Yet the approach to resolving it doesn't require a lot of, innovative tools. For example, I wouldn't propose that you ask somebody if they're lonely because there is a certain stigma.
Mm-hmm.
There is a certain sense that I don't want to admit that I'm lonely. But you can ask questions like, did you have a good weekend with, your family or friends? And
Mm-hmm.
if people are experiencing isolation, they'll come back and say, no, I was all by myself. And so you want to be able to ask the question in a way where somebody can feel comfortable in revealing what might have been their activity for the last week. The other is that what we've had a decline in listening to the stories of other people. And that has been, in many respects, one of the chief contributors to why people feel isolated. And so a lot of times what I will do is not only ask about your why, I will ask you to share your story. And it's interesting. It's almost like the light bulb, shines when you ask somebody, tell me about your story, especially somebody who is 70 years old, who might not have had an opportunity to share their life's experience. And so we've got to get back to not simply using technology as a solution, because what we've been thinking is that the iPhones or our devices have really solved the problem with the loneliness. No, it's created a problem because people are not looking eyeball to eyeball. They're not associating themselves to asking stories from the other person. And so the last 7 years, I have been one of the key catalysts in promoting, and by the way, much of what I'm doing is just raising the awareness of what we can do and how we can open up, if you will, the sense of relevancy in one's life. Because what's happened is people's sense of relevancy unfortunately declines. And it declines once you leave your work environment. If you haven't found anything to replace your job and your professional responsibilities, you then begin to fall into this, significant state of losing your sense of relevancy.
Speaking of technology, talk a little bit, if you would, about, I think this is probably of all your projects, the most compassionate of them all on a scale, but eVillages, founded in 2011, you saw that 1 billion people go into their graves, no access to healthcare workers, medication, clean water, affordable healthcare facilities. It's 2011. Talk about the idea behind the state-of-the-art mobile health technology addressing these significant gaps in what's happening in the rest of the world, the part that most of us don't see.
Well, it's a very, and again, it's another, it's funny when you raised this, I paused for a second and said, a lot of times I will kind of do a check and balance on whether or not I am practicing compassionate leadership. And as you were speaking, you're absolutely correct. There's a great example that I was on a plane reading this article that in our lifetime, 1 billion people will go to their graves prematurely because they did not have access to a healthcare worker. Now, I could have just walked away and said, hey, that's not my problem. And by the way, a lot of people said that to me. It's not my problem. We got enough problems, here in the United States. But that's not the way a compassionate leader works. I basically said to myself, this is terrible, that because of your zip code, you don't have the same access that you and I have here in, the first world. And so I realized that there was no way that I was going to be able to educate enough physicians to resolve this problem. Case in point, in India, a population of 1.3 billion people, they have the same number of physicians in India that we have in the United States for, 1/4 the population.
Right.
And so the answer wasn't educate more physicians. And so the idea hit me that in the company that I had founded, Physicians Interactive, we had a technology, a mobile device that could be deployed in these emerging countries, and that the devices could help physicians to treat thousands of individuals that normally would require many physicians and healthcare workers. And I'm very pleased to share with you the results. In a small village in East Africa, Luwala, in 2011, 100 babies per 1,000 live births died. As a result of their program and the Healthy Villages technology, we have reduced that number to 20. 80 more babies per 1,000 live births are now alive because of Healthy Villages and the Luwala Community Health Alliance. And so technology in that case works. We empowered the local villagers with these devices. It was kind of funny when we first gave them the devices with the medical content. They didn't know how to turn the device on. Well, we taught them how to do it. Just because you are poor doesn't mean you don't have the intellectual capacity to do the things that you and I do. And so that is one example in the last 10 years that I am so proud of, that we were able to really move the needle. And by the way, once we addressed infant mortality, we were finding that the children from 2 days old to 5 years old were dying. And so we developed a pediatric program, and now we have reduced pediatric mortality. So technology is critical.
Yep.
It's not the only answer, but if you look at the word collaboration, we need innovation like technology, but we need the human hands to collaborate as well.
Absolutely. Donato, it's such an impressive portfolio of what you've been doing and what you're up to. I really cheering you on from the sidelines here in Philadelphia, but watching from a distance, and just I encourage everybody. We're going to put the links to all of these initiatives in the bio of the show. But really, as I said, wishing you the best with all this as we move forward in 2022. For everybody that's going to be listening to this particular show on the podcast networks or watching on the YouTube channel, you've been listening to Donato Tramuto, founder of the Tramuto Foundation, founder of Health eVillages. Definitely pick up the copy of the book, which should be out shortly, Double Bottom Line, How Compassionate Leaders Captivate Hearts and Deliver Results. Donato, it's really fascinating listening to your whys, your story, and everything you've accomplished and continue to accomplish. I want to thank you for taking the time out of your schedule. I know it's late there in the evening in Italy to come on the show. Obviously, thank you for everything you're doing and continue to do. And as we say on this show, thanks for helping to create a better tomorrow through what you've been doing. It's really so impressive.
Well, thank you. But, I would be violating my, question I asked. Your why? What is your why?
3 beautiful children and a beautiful wife, and I want to be there here for them, and I want them to be here a long time, and that's all. It sums it all up. If they were here, I'd bring them on the show right now, and I'd show you my why.
Great answer. Now I see a picture behind you. Is that?
Those are my daughters, and
okay.
I have to point those out. But yes, she mandates that they are part of my show. So,
well, in the few minutes that I've had with you, I can tell that you have a very compassionate heart, and if you would have given me a different answer than that, I would have been somewhat surprised. So the children are important in terms of our future. And, I'll leave you with this. And I've said this so many times to people that I have met in the promotion of the book. I really think our children need to really see that compassion and kindness coming from their parents, coming from their families. We owe it to our children
Absolutely.
to ensure that they inherit a kinder and compassionate world. We can disagree. We should disagree. That was, allows for healthy innovation. That said, we need to disagree in a way that shows respect and kindness to the person who might have a different opinion than what we have.
Yep, absolutely. Great seeing you.
Make it a great day.
You too.